Hey, I'm Di McQueen, licensed clinical social worker, family and addiction expert. I'm here with Dr. Brian Jackson, my longtime cohort who specializes in the field of addiction. Welcome to Healing Families Shattered by Addiction.
Di and I have worked with addicts, alcoholics, and their families for over 30 years combined. Our podcast and coaching programs focus on families who have a loved one suffering from addiction. Our experience has been that this disease affects families as much, if not more, than the addict or alcoholic.
Is your world spinning out of control? Are you codependent? Are you experiencing worry, loss of sleep, and difficulty concentrating? If so, you're in the right place. Brian and I have both personally lived it, learned it, and now we're going to teach you tools and techniques on how to get your life back that you thought was shattered by addiction.
Okay, let's dive in.
Brian and I are so excited to introduce to you our new sponsor, Lakeview Health. They are a wonderful residential treatment center. Whether it's the family member who is looking for a place or the addict or alcoholic themselves, this would be the place that we would refer them to. Brian, you have many years of experience with Lakeview.
Yeah, Lakeview Health is a center of excellent addiction treatment. They take an evidence-based approach, medical approach to treating this complex brain disease. They hold the Joint Commission's Golden Seal, and they were voted one of America's best treatment centers by Newsweek magazine. They deliver dual diagnosis, gender-responsive, and trauma-informed care at their gorgeous facility here in Jacksonville, Florida. But they do see people from all over the world do come here to Jacksonville to go to treatment at Lakeview. Their levels of care include medically supervised detox, which a lot of people do need. Then they stabilize them in a residential rehabilitation and partial hospitalization program. They have board-certified physicians, master-level therapists, and they work to address the unique needs of each patient. So in other words, it's not a cookie-cutter program. They help individuals build skills for long-term sobriety. So if you or someone you know needs treatment, please visit their site at lakeviewhealth.com. We also have a hyperlink on our website at familyandaddictionexperts.com where you can just click and get some information about Lakeview Health. And Diane, I think you have a number for people to call if they would like to inquire about treatment.
I sure do. That number is 888-480-3799. That's 888-480-3799. Give them a call.
Hi, everybody. This is Dr. Brian Jackson. Welcome to Healing Families Shattered by Addiction. I'm actually here today with Philip Warwick, who is the clinical director over at Lakeview, over the men's facility, which is the STAR. And Philip is a licensed mental health counselor. As you know, Di and I have felt as though Lakeview Health is probably one of the best inpatient treatment facilities in the United States. And those of you who have been listening for a while, you all know that I went to Betty Ford, and hopefully I won't be faced with that choice again. But if I was faced with it, I would definitely pick Lakeview based on our experience of knowing the people there, the facility itself, and just how they are not a cookie cutter program, and they really tailor treatment to the individual. So Philip, thank you so much for joining me today. I know you're a busy guy over there. You guys have a big census.
Absolutely.
And so I was hoping that maybe you could, for those family members out there listening that have a loved one with an alcohol use disorder or substance use disorder, who might be, on the verge of making that decision to go ahead and make the commitment to treatment. And I know you treat people from all over the country. It doesn't matter where they are. And I think you've had a couple from outside the country. So
we have.
So I was hoping you could maybe take us through what it's like for people that have concerns. It's normal, like what's going to happen when I get there? What am I going to be doing when I'm there? That kind of stuff. So
yeah, I think when patients or people are making the decision to potentially seek help from themselves, there are a lot of nerves that are surrounding that decision, a lot of fear and anxiety, and so I want people to feel comfortable wherever they end up going. And I'm very fortunate to work at Lakeview Health, and I've worked in other treatment facilities, specifically in the state of Florida before, and I can definitely say, Lakeview Health, aside from the resources that it has, just the staff that we have really has allowed me to enjoy my job. But then obviously to the benefit of the patients, our outcomes have really shown that we have a real good program. So I feel so fortunate. The reason I say that is I just feel so fortunate to be able to work at Lakeview and be a part of this and get to see the patients go through the early struggles of recovery, but find success throughout early recovery into long-term recovery. So it's been a real honor to be able to work here. So we get patients from all over the country, which is actually really cool. And the Caribbean, actually, when you say out of the country, we get a number of patients from the Caribbean too. A lot of those Caribbean islands and countries don't have a whole lot of resources, and so we
Oh,
do
wow.
tend to get a lot of people
Okay.
from the Caribbean that can come through, as well as other countries. But so at Lakeview, we do run all levels of care. So we do detox all the way through even IOP, which is what's called intensive outpatient. So that's what that stands for. When patients first come in, they're going to go through a full detox process with us. So we try and make that process as comfortable as possible for the patients. So we have a full medical team, obviously a full clinical team, and nursing teams that really help create that comfort for the patients while they go through those initial, typically 5 to 7 days when they're going through the bulk of their detox, I would say. And in terms of what we see most common, a lot of alcohol, and then a lot of opiates are probably the two biggest, and then we'll see a number of people coming off of cocaine or amphetamines and some of the other ones. But I would still say alcohol and opiates are probably the two most prevalent. But we're pretty skilled in dealing with really any substance that a person's coming off of, and we get quite a few of all different kinds of patients. So initially, while they're going through that detox process, we don't want to overload any person with real intense groups or intense individual sessions or family involvement or anything like that. So we start patients off pretty elementary. It's a lot of foundation building, a lot of psychoeducation. So they'll be placed in a therapist group called New Beginnings, and in that group, we do a lot of like the foundational work. So an introduction into maybe self-help and what self-help is, and the different forms of self-help that exist out there. We'll introduce them to the disease model of addiction, actually show them what is going on in the brain when they're struggling in active addiction versus when they're in recovery, and how those changes impact their behavior and the way they think about problems cognitively. So again, a lot of more psychoeducation over that first week. We're also going to do a decent amount of assessing. So one thing that almost all of our patients have is what's called dual diagnosis. So they come in with a substance use disorder as the primary diagnosis, but there's something else is going on that was contributing to that substance use disorder. It either developed as a result of the SUD or was the reason that the person started using. And so we want to assess the patients pretty extensively to uncover what those underlying conditions are. So for example, depression and anxiety, or bipolar disorder, or PTSD, post-traumatic stress disorder, any of those underlying things. We want to be able to pinpoint them. That way, when you said we're not a cookie cutter facility, that way we can pinpoint the approach that we want to take in treating the addiction. Because how you treat somebody with underlying PTSD is going to be very different than how you would approach treating substance use disorder with somebody who has, say, depression.
Yeah,
so
so exactly. So Philip, I wanted to ask you, the dual diagnosis that we talk about can manifest itself in so many different ways. And I think a big percentage, like you said, is some form of anxiety and or depression. And with the disease model, I think patients get a little bit more comfortable that it is in fact a disease, that they're not a bad person to be trying to become a good person, that they're sick right now and you guys are trying to help get them well. But one of the sayings around recovery is drinking or drugging is but a symptom of something else. And so I think what you're pointing out is once you remove the alcohol or the substance, now you guys can really assess what is going on with this patient that is captured audience with you guys.
You got it. Yeah, and that was very well said. And that's exactly right. We can, if we were to just treat the addiction, just the substance use, and then you say, okay, they're in recovery now, so and on your way, on your way to the next step, the likelihood of relapse is going to be very high because we haven't treated the issue, like the core issue, the issue that was contributing so greatly to that substance use. So yeah, you're absolutely right. And a big part of our treatment program here is once we get them detoxed and get them stabilized, and not so foggy, then we can really start to dive into that underlying stuff. And we have therapists that specialize in different areas. So we have some therapists that really specialize in trauma. We have some therapists that we do a lot with first responders and veterans. And so we have some therapists that work primarily with our first responders and veterans and that population. We have some therapists that are really good with working with our professional population. So we do have a number of professionals that come to treatment at Lakeview. So you picture pilots, for example, or flight attendants, physicians, nurses, those kinds of professions. They have a very different set of issues that they're dealing with than some of our other populations. And so we have therapists that specialize in treating those patients, which is a huge advantage for preparing them for what the next step's going to be in their recovery once they discharge from us. But again, it all comes down to if one thing that we don't want to do is miss any of those underlying issues. If we're going to assess them on the front end pretty early, we have to be real careful with doing that because it's very easy for a patient to either misrepresent themselves or say something that's not 100% accurate in early recovery when they first get here, when they're in detox. And so we want to make sure that we assess them early on, sure, but we want to reassess them ongoing throughout their stay, because a lot of people, and I'll use PTSD again as an example, or trauma in general, they don't understand what trauma is or the impact that it's had on them. And so it's easy to dismiss, and say, I don't have trauma or I don't have PTSD, especially early on. But then as we do some processing with them, it comes to light, like, okay, obviously there's some trauma here and there's some criteria for PTSD that's being met. And so now we need to switch and make sure we get them involved in those resources here at Lakeview.
Yeah, and that's a really, really good point. You want to put time and distance from the last time that the person used, because when you see somebody under the influence where their brain is drugged either by alcohol or some other substance, it's real easy to say, well, that person looks like they're bipolar or this, that, or the other thing. So really hard to diagnose them early on. And I know you have a staff psychiatrist on board here, and I'm probably jumping ahead of you in terms of medication assisted treatment for what you guys determine. So let me stop talking.
No, you're totally right. We have a team of psychiatrists that really help out, and I'll talk a little bit about the medication assisted treatment here in a second. But I think you brought up a good point too, in that not diagnosing anything too early, especially the underlying stuff, the secondary diagnosis. If a patient comes in with a history, that we have the medical records from maybe their home psychiatrist or something like that, then we can work with diagnosing a little bit easier. But if they're coming in and we don't have that information, then we definitely don't want to jump to any conclusions with anything. And that's again why we take our time with that and reassess to see kind of what's going on. And we have a full team of medical providers and psychiatrists on staff that will meet with each patient. So we'll do, aside from the typical health and physical and biopsychosocial and all those background assessments, we're going to do a full psych assessment as well. When they first get here, and then they'll have ongoing psych appointments throughout the time that they're here. The big thing that we utilize in terms of MAT therapy or medication assisted treatment is we use Vivitrol, naltrexone, and Vivitrol quite a bit, which are the receptor blockers. For those, I don't know if I need to go into too much detail about it, but Vivitrol is a wonderful medication that we utilize with some of our patients for specifically opiates and alcohol. Because what it'll do is it'll actually block the receptors, the dopamine receptor cells, so that they won't get that release of dopamine, which can be a big kind of tool that they'll have, I guess, on their tool belt, especially through early recovery. So we really like that that option. The other big thing with Vivitrol is it cuts down on cravings significantly. And so a big thing that patients struggle with throughout early recovery, those first, well, I would say long-term recovery too, potentially, is those cravings that occur from various things, whatever triggers they have, that may jumpstart some cravings, or just life in general is full of triggers and can produce cravings. And so Vivitrol will actually help cut down on those cravings quite a bit. So I really like the anytime we can get a patient to utilize that medication. And they'll also work with psychiatry on other medications, non-narcotic medications, to treat, whether it be anxiety or depression, or if they do have bipolar, what kind of medications we'll work with them on that. So we kind of have that whole package. We want to treat the patient medically. We want to treat them clinically, and in terms of clinical, we'll use a plethora of different approaches, everything from holistic wellness, meditation approaches to the known therapies that work really well with addiction, basically the behavioral therapies, but cognitive behavioral therapy, REBT, and there's 4 or 5 really key ones that we use quite a bit throughout the episodic care here. And then trauma therapists, trauma therapies as well. We have a couple of therapists who are trained in specific trauma therapies, like EMDR or ART therapy, which is a newer trauma therapy, which has really good results as well. The one thing I do want to clarify, I want to make sure that I say this: we treat trauma, but we are very, very careful about how deep we go with them while they're at Lakeview. And what I mean by that is, if Dr. Jackson, we have patients that come in on day 1 of detox, and they're going to be with us, say, 6 to 8 weeks. The last thing we want to do is overexpose them or start diving into that trauma too early, and which could potentially result in a relapse. So a lot of the trauma work we do is going to be foundational trauma work. So if you think of like the first couple sessions of like EMDR therapy, where you're really learning about a safe space, learning about how to self-regulate emotions, learning some coping skills to deal if your trauma is triggered, some things like that, and then pointing out the importance of continuing that work once they discharge from our facility. And so we'll set them up before they discharge, we'll set them up with an individual therapist that can continue that trauma work at the next stage, assessing them beforehand to make sure they're appropriate to start it at that time. Again, I'm just real careful, because I always get nervous that some treatment centers start to dive in a little too quick to dealing with the trauma, and I think it can be dangerous sometimes, especially if the patient's just not ready for it. We get patients who want to jump into it so quick when they get here, and we want to make sure that we slow them down. You'll have an opportunity, but we just don't want to jump into it too quick, if that makes sense.
Yeah, and the thing about trauma, I think some people have this it's not a misconception, but a conception that trauma has to take the form of like being in combat or being sexually assaulted.
Right.
And as an accelerated resolution therapist myself, what I
There you
find
go.
is
Yeah.
what I find is there may be some childhood traumas as simple as, children picking on or bullying them when they were children, and they carried that around. So trauma comes in all shapes and forms. And the longer I've been in this business, counseling, working with patients, there's a high degree of trauma in many, many shapes and forms. Yep. That are not like these major catastrophic things that you normally would think of as trauma.
Yep. And I absolutely agree with that. And it comes in all shapes and forms. And the like almost like when I was talking about depression earlier, the trauma can come and exacerbate an addiction, or the trauma can come while they're in active addiction, and then you have that on top at that point. And so it is and all shapes and forms. And then we don't rank trauma. There's nothing better or worse. It's just how can we help you? What can we do? And what's the best approach for this specific trauma? I like that you said the childhood trauma has a huge impact on the development of a person's personality, and then obviously potential addiction down the road. I always found that we use schema therapies a lot, and actually one of the assignments that we have patients do is looking at childhood schemas and maladaptive schemas and seeing the impact of those. And you can a lot of times uncover hidden trauma that you didn't know was there, and doing that schema therapy. And it's really interesting to see those aha moments with the patients when they're doing that schema work, when they see how that contributed to their development through the years, and how they think about problems and think about issues, and then the behaviors they engage in as a result. And so yeah, it's absolutely true. Yeah.
Yeah, and so I just wanted to put in another plug for Lakeview. A lot of these facilities that these inpatient treatment facilities, you have these suits up at the top, the CEOs and everything.
Yeah.
And then you have, your therapists and your doctors and everything. And one of the things I love about Lakeview is from the CEO on down, therapy and treatment is really first and foremost in everybody's mind. So I just really think it's cool that Jamie, who has worked as a counselor in the past, is the CEO of the company.
Yeah, I mean, she's an inspiration. She started out as a therapist, and then here at Lakeview, and then worked her way up to that CEO role, and she's really kept that clinical mindset the entire time. And so there's a lot of extra attention going into our clinical team, all of our teams really. But I mean, it's just great to be able to see it in action here at Lakeview. It's really neat to be a part of that. Yeah, I absolutely agree. So with the patients here, we do offer. I'll just kind of include like a few more things that kind of afternoon. We call them afternoon programming, but some extras that we have here at treatment that I'm pretty proud of, and I love to be able to share with people. So the morning hours are typically more of our intensive groups. They'll do their main psychotherapy group with their primary therapist, where they're really diving pretty deep into whatever topic the therapist or the patients bring in on any given day. And so we wanted to make the afternoon a little bit more, relaxed is not the right word, but a little bit more fun maybe for the patients. And so we do a lot more of our expressive groups, where we get the guys, the men or women, up moving around in groups. We'll do more sculpting and more immersive groups in the afternoon. So our expressive arts and expressive music groups we offer in the afternoons, and those are run by licensed art therapists and music therapists. So it's pretty cool to and we actually just brought on a drama therapist as well. And so we were really excited about that, because she's going to be able to start getting the guys more involved in some of that psychodrama therapy, which can be huge for patients, especially if they click with that kind of approach. You can see some really fascinating stuff going on in those groups. And then we also offer our experiential groups. So we do equine therapy, and one of my favorite is surf therapy, which is pretty cool. So we work with a local group here, and they actually do a 2-hour surf lesson out here at Atlantic Beach in Jacksonville with the men and the women. And then we have one of our therapists go out there. I always like to brag. It's the best group to facilitate, because you get to go hang out at the beach for the last half of your day as a therapist. So it's not a bad group to get assigned to run. I used to run that group when I was a therapist here. And so you get to go out there, and you do actually a 1-hour process group on the beach following the surf lesson. So it's a really, really cool environment to be able to do a process group. And then afterwards, you come back to the facility for dinner. But that's just one of the neat little things. We have a 10,000 square foot gym as well, and it's got free weights and machine weights and kind of anything you can imagine. We really have an emphasis on that piece as well. When we talk about that holistic approach, we want the men and women to really start to kind of take pride in themselves again, and get over to the gym and really utilize those resources as much as they're willing to. We have personal trainers over there and physical therapists that work for us, that both the men and the women can take advantage of when they're here. They have separate times. One thing that I didn't mention was that gender responsive model that we use here at Lakeview. You had said in the beginning that I'm the clinical director of the Star, which is our men's facility. And we have Heidi, who is the clinical director of the Rose, which is our women's facility. And so what's unique about Lakeview is that we have two completely separate facilities. I mean, the buildings are apart from each other, and the men and women never interact with each other while they are in treatment. They go to the gym at different times. Any of the equine or the experiential groups they go to at separate times. And that has some unique advantages. And a couple of the kind of big one that stands out right away is you don't have to worry as much about the pairing or the relationships between the men and women that can form unhealthy relationships that can form in treatment. I always share the story of in 2016 is when I started here at Lakeview, and I was a therapist. I started in February, and at that time we were still all operating under one roof. We had not gone gender responsive yet. We hadn't opened the women's facility yet, and so I got to see the patients interact with one another with the genders together. And then in June of that year of 2016, that's when we opened up the Rose and we split it. And I mean, like overnight, you would see a massive change. All of a sudden, these men who were putting up this huge boundary and trying to give up this, kind of tougher macho attitude, all of that stuff went away, all of it overnight. And they became more willing to share openly in group. They became more willing to get vulnerable and to process in those group sessions. One of the other cool things was they became more willing to build relationships, healthy relationships with one another. The men did. They were more willing to take one another under each other's wings, show them the ropes, really develop a lot of those healthy relationship building skills in early recovery a lot quicker than they were able to before we opened the Rose facility. So
yeah, that's hugely important because like when you have a co-ed group, I think men may put a governor, on the things that they might say and vice versa. And so if you're really not getting honest, how are you going to get better? So once, you have that gender specific treatment, like you said, I think the breakthroughs that both the males and the females can have if they're, because they have different issues. And how we are, men and women together, it's just, especially in early recovery, you could get distracted from why you are at the facility. So I think that's great, Phil.
Yeah, it was. Like I said, I mean, just it was really neat to be able to see the change overnight with it. It was kind of a unique perspective that I got to see there, and I'm grateful for that. We do have a big piece, and I'm sure you could probably speak to this. A big piece of treating somebody is not just treating the patient, but also making sure that the family is getting what they need. In terms of resources and treatment as well. If the expectation is that you're going to send your loved one to Lakeview and then we're going to send them back fixed and life's going to go on, that's kind of a little bit of a delusion, because the patient sure is going to be here working on their recovery. I always ask the family, so what are you doing back home to work on your own recoveries? Whether that's individual therapy, whether that's Al-Anon meetings, whether that's family therapy. What are you doing back home? One thing that we offer here at Lakeview, anytime a patient comes in, we're going to reach out to the family within 24 hours of the patient getting here, so we can gather some collateral data and kind of get an idea of what that family dynamic looks like. We have family support groups and we have partner support groups weekly that we encourage family members to attend. We encourage them to attend weekly, and they're run by our licensed marriage and family therapists, and they're virtual. So like you said, we get patients from all over the country. Well, the family members can patch into these groups, and it's just for the family members. The patients are not present during these groups. The family members can patch in and actually be part of the treatment. They can actually receive some of that support during those groups. And so we encourage all family members to do that. And then we also offer our family workshop, which is an intensive family workshop that we run every single week. And that's run by Dennis as well, our licensed marriage and family therapist. We try and get every patient to participate in it one time while they're in treatment. And that 2-day workshop is it's every Wednesday and Thursday that we run it. The first half day or so is a lot of psychoeducation. So we go over the disease model, we introduce self-help, we have one of our providers actually come in and talk about what's going on in the brain, actually show the brain scans of what's going on in active addiction versus in recovery. We have our alumni panel come in. And I always like to touch on this because I think it's one of the most powerful pieces. We have alumni come in and speak to the patients quite often, and then we have an alumni panel in the family workshop, and we want them to share their story and about the successes they've had in recovery. You know, a lot of families and a lot of patients have struggled for a long time, or have not had a lot of hope, or seen a lot of hope or light at the end of the tunnel, and you know that's a scary place to be, one, but it's also not a great representation of the outcomes that we see from patients, especially leaving Lakeview at least. And so we really want alumni to come in and share those stories of inspiration and hope, and share about the triumphs they've had and the success that they've had in recovery, and that can help patients see, like, okay, I think I can do this too. Look at this person, look what they've been able to do just by following these steps. And so it can help guide them in a sense. And then for the families too, it can give the families a lot of inspiration and hope, who maybe haven't experienced a lot of that in the last number of years, as they've seen their loved ones struggle in active addiction.
Yeah, and that's why Di and I started Family and Addiction Experts, because both of us had worked as primary counselors and clinical supervisors and all
Yep.
that stuff, dealing with the primary patient. And when we decided to start this, we said, where's the void? And the answer came to us clearly. It's the family, because I think the family gets sicker than the person who is actually has the
Yep.
disorder. And they really don't know what to do. It's, they're ruminating about it. They're anxious about it. They can't understand why their loved one is doing it to themselves. And so, with the patients that leave Lakeview, I mean, you guys have a great alumni group. You stay in touch with people after they've left. You make a discharge plan for them, in
Yep.
terms of going to AA, getting a sponsor, all of that stuff. And a lot of times with families, we found when we were working with primary patients, we would recommend Al-Anon, and Al-Anon was not for everybody.
That's
So
very true.
we work as a continuum of care with family members, because sometimes when that sober person re-enters the family unit, everybody's dancing different, and it's a little bit awkward in terms of how they interact. So, I love the way you guys approach the whole system, from, detox and stabilization to individual treatment plans to dealing with trauma to having recreational, to make recovery fun,
Yep.
but yet including the family as part of, as opposed to, like, a lot of families will say, all right, I'm going to send him there, you guys fix him, and send him back when he's sober.
Yep.
And that's not really kind of thinking it through.
Yep.
So it's a real awareness that I appreciate that you and everybody at Lakeview does have in terms of family
Absolutely.
systems.
Absolutely. Yeah. And you'd had mentioned that aftercare piece too, and I think of everything, that can be one of the most powerful things we can provide a patient, is making sure that they have that good aftercare plan for when they leave Lakeview. What's going to be the next step, and what we found is that the earlier we start that process, the better the buy-in is from the potential patient. I mean, if you try and set up aftercare with a patient, a couple of days before they discharge, you're not going to be able to get that buy-in. But if aftercare is started, if planning for that piece is started early in the treatment process, then it's just the natural next step in the recovery.
Right, and I think you had talked about IOP, which is intensive outpatient treatment. So, I think it's real easy to stay sober when you're in a controlled environment like an inpatient treatment facility.
Yep.
Because obviously you're not serving drinks or drugs while
Yep.
people are there. And then we get out.
Yep.
And out here in the real world is where we're used. And what I really like about Lakeview is you have people from all over the country. However, you do have affiliations with different intensive outpatient treatment facilities wherever it is, whether it's Texas, California, New York, New Jersey, so that you can kind of set that up. So it's a step down, because the real challenge, I think, for relapse prevention is now, continuing the journey of recovery, and, and staying plugged in.
Absolutely. Yeah. No, you're absolutely right. Um, what identifying what are going to be the best resources for this particular individual as their next step. And I think a good start is always that finding that good IOP program in the area, in the local area that they're from. And then branching out from there with, specific kind of individual therapist, sober living, what are the pieces that are needed for this person? Yeah, absolutely.
Yeah, and the medication assisted treatment, like where
Yep.
are they going to go to continue the
And-
medication stuff?
And I will say this too, is kind of, I know we're getting toward the end here, but I think, the having all of these appointments, whether it be the IOP or the psychiatrist appointment, all this stuff, like our goal for a patient when they leave our facility is we don't want them to have to call any number to set these appointments up for themselves. We want every appointment before they leave. We want them to have a date and a time, and they just need to show up once they get home, because it can be a struggle when you get back. You're going to hit challenges early on, and there may be some roadblocks that get put up in front of you, and it's really, really important that we make that transition into aftercare as early or as easy as possible for the patient. And so we want them to be able to leave our facility with everything planned out, a full map in front of them. And all they will
Right,
need to
and
do
you guys don't dictate what that is. You have
Right.
the patient be involved with you. Like,
Oh,
for example,
absolutely.
there's an
Yeah.
IOP that's 5 miles from my house, and there's an IOP that's 2 miles from my house, and and if you guys have experience with it. So, I mean,
Yeah,
that's a
and
really cool thing, because nobody likes being told what to do, but to have, a patient to be able to interface with their counselor and their discharge planner, and, agree that, this is the best thing for me in terms of what you guys are recommending.
You said it. Yeah, absolutely. I mean, if you want buy-in, then they need to be a part of the process. And that's true for every step of treatment too. When we're doing treatment plans for patients, they're right there with us, helping us create those treatment plans, identifying what their goals are, what they want to work on. Now, the therapist can help guide that a little bit. But you're right. I want buy-in from the patient. The only way you're going to get that is if they're a part of the whole process.
Yeah.
Yeah.
Well, anything else you want to say about Lakeview or the men's program, or?
I don't think so. I think I covered most of it. Again, I will say, it's been and I tell people this a lot, and I really mean it. It's been an honor to be able to work at Lakeview. Working in substance use disorders is incredibly rewarding. You get to see a lot of progress pretty quick with patients. And then being at Lakeview specifically, I mean, with the resources that they have and the staff that we have, it's just been an honor to work here, and I've been very fortunate to grow and develop as a therapist here, and to get to see all the patients as they pass through Lakeview and on to better lives ahead of them.
Yeah, and I've heard nothing but great things about you. I don't mean to embarrass you, but but we're just a big proponent of Lakeview for so many reasons. But basically, the clinicians really everybody there seems to really care.
Yeah.
It's a business, but it's run a lot differently than most inpatient treatment facilities, that my experience of 23 years of working in the field. So anyway, so if you have any questions, you can email us at info@familyandaddictionexperts.com. If you have any questions for Philip or about Lakeview, I'd be more than happy to forward those on to him, and we'll get you an answer back. We do have a family survival kit on our website at www.familyandaddictionexperts, where you can download some information for families. And you can listen to the podcast here on iTunes or Spotify. I can't remember them all because I'm too old. Anyhow, but Philip, thank you so much for taking time out of your busy schedule. It's been a pleasure to hang with you, and hopefully I'll get over there and maybe we can grab lunch or something.
Absolutely, I would love that. Thank you for having me.
All right, thank you, Philip.
Thanks so much for joining our podcast, Healing Families Shattered by Addiction. We'll be back in a couple of weeks with more important tools, techniques, and ways for you to focus on you instead of the alcoholic or addict in your world.
Until then, please go to our website, familyandaddictionexperts.com. That's familyandaddictionexperts.com. You'll also see links to our Facebook and Instagram pages. Please also, if you have any emails that you would like to send us, that's info@familyandaddictionexperts.com. That's info@familyandaddictionexperts.com. With any thoughts, feelings, questions that you may have for us, we would love to hear from you, and we look forward to seeing you in a couple of weeks.